Good morning, everyone. My name is Jessica Bland. I attend Waynesburg University, and today I would like to share with you a patient safety initiative. Patient safety is at the forefront of the healthcare industry. Per American Sentinel University, hourly rounding can be defined as a systematic, proactive nursing intervention designed to anticipate and address the needs of hospitalized patients. The purpose of the Patient Safety Initiative, or PSI, is to explore how hourly rounding is affecting patient safety. The goal of the PSI is to identify successful ways in which hourly rounding can reduce the risk of falls. Hourly rounding includes 5 assessments with possible intervention when entering the patient's room. Assess the patient for pain. Assess any toileting needs. Reposition the patient. Check that everything the patient needs in their periphery is within reach, such as their call light, water, trash can, phone, any personal belongings. Check the IV pump. Toileting needs are one of the most common reasons for falls in hospitalized patients. Studies on the circumstances surrounding patient falls in United States hospitals showed 38 to 47% of falls were associated with toilet-related activities that occurred in the bathroom, per Cross, Evanoff, and Hitcho. The focus of hourly rounding is on toileting needs that could lead to a potential fall. Safe transfers and physical stabilization from nursing staff improves the patient's safety during toileting. Patient safety and patient satisfaction mirror one another in the healthcare setting. Krepper et al. Suggests that hourly rounds on hospitalized patients can improve the patient's perception of care and improve patient safety. If patients have a perception that they are bothering the nurse, they are less likely to ask for assistance with their ADLs. Hourly rounding affords the patient the opportunity to ask for assistance, and the patient does not feel as if he or she is interrupting the nurse. In turn, the patient feels more comfortable in any request for assistance, and there is a decrease in the risk for injury related to falls. In the healthcare system where I am employed, hourly rounding began as check marks and initials on a worksheet. It was easy for staff to be late on the hourly checks. If a nurse got behind on her medication pass, she could go in 2 to 3 hours later and put her initials in a check mark. While nurse management attempted to complete periodic checks to ensure rounding was being done, they were not able to have any type of real-time way to ensure proper completion of hourly rounds. When electronic records were introduced, hourly rounding required a timestamp in the computer system, with the CNAs, LPNs, and RNs being responsible for completing the hourly rounding in the computer. Then each CNA, LPN, or RN could go in the computer and see what the other discipline had completed. Now, an electronic tracking system called Responder 5 has been initiated at my facility. Responder 5 includes a panel in each room that has rounding, fall risks, reassessment for pain, and lights outside the doors of the patient's room that says if an RN is needed or if physical therapy is needed, and that prompts the nurse to go into the room. The nurse has a tag on her badge that picks up through Wi-Fi to identify that the nurse has entered the room. Responder 5 was not perceived well at first. Nurses felt they were being tracked. 95% of the staff has now started to participate in the Responder 5 system. The panel in the room was not used in the first month following installation. This was due to lack of education with the staff. Once educated, the electronic panels within the rooms have been used so that other healthcare professionals can see what tasks have been completed for the patient already or what tasks need done. The light systems allow the nursing assistants to turn on a green light to get the RN's attention to come into the room for either medication, pain assessment, or whatever request the patient has that the nursing assistant cannot complete on her own. At this point, at the facility where I'm employed, Responder 5 is being used at 100%. Through working with the nurse manager leading the safety initiative, it was decided that nurse leaders should be identified on each shift. There are two 12-hour shifts within the day. 2 RNs and 1 LPN were identified as nurse leaders. Compliance with the system improved because of this. Root cause analysis on each fall that has happened after Responder 5 was initiated has shown compliance and improvement in hourly rounding within the healthcare facility. The root cause analysis that I chose to work on was a fall that happened on our behavioral health unit in a patient with schizophrenia. Unfortunately, the patient suffered from an intracranial hemorrhage. It was found that there were many factors that contributed to this patient falling. Factors related to the fall included the patient not having non-skid footwear on. He had been wearing his own shoes and did not have any socks on. The hospital supplies each patient with a pair of socks that have non-skid grips on the bottom, but he did not have these on. The patient also was taking multiple medications that could result in dizziness that could have led to his fall. There was no fall risk assessment completed during the morning shift by the nurse. Hourly rounding was found to be completed with this patient. Factors related to nursing issues. A rapid response code was not called immediately after the patient fell. There was poor communication between the hospitalist, the emergency room physician, and the nursing staff. Please keep in mind that the facility that this occurred in is a very small facility in the country with only 23 medical surgical beds and then 25 psychiatric beds. There is a hospitalist in the hospital 12 hours a day and an ED physician 24 hours a day. There was also a lack of education for the agency nurse who had been assigned to the patient when he fell. After this patient fell, a root cause analysis or RCA was performed. Nursing leadership instilled stricter policies and procedures. Mandatory training was began, and each staff member had to complete this training or they would receive written or verbal warning. One of the issues was that the patient was not wearing non-skid footwear. Now, within the unit, every patient is to have on non-skid footwear at all times. Nursing assistants check to make sure this is occurring periodically. The IT department built in a protocol in the PICSs that if a medication had a side effect such as dizziness or drowsiness, an alert is prompted to the nurse within the PICSs that allows her to see that this medication can cause these side effects before the medication is withdrawn from the PICSs. The IT fall safety protocol was initiated and it prompts the nursing staff to be aware of the risk for falls due to medication side effects. Per the medication management policy, the pharmacist is also to provide consultation regarding drugs and drug interaction. All employees, including agency nurses, are to complete a full orientation packet that requires certification of completion. The nursing staff also is to train agency nurses completely on the unit. Prior to this patient falling, agency nurses would just shadow the regular staff nurses. That is no longer happening at this institution. To improve communication, provide SBAR worksheets for nursing staff to use prior to calling the hospitalist. Nurse leadership began doing this. It's been suggested that SBAR is a means to avoid unclear communication between healthcare professionals and in turn enhances patient safety in the healthcare sector, per Blom, Peterson, Hagel, and Westerngren. The quality control nurse is to institute monthly fall committee meetings. Behavioral health unit staff is mandated to participate in these monthly meetings. The patient safety plan states that patient safety is a priority for leadership of the healthcare system. The health system leadership supports a systematic, coordinated, and continuous approach to the improvement and management of patient safety. Implications for nursing leadership. When patients are being evaluated by a healthcare provider every hour, the patient begins to feel safe and comfortable during a stressful time of illness. Through hourly rounding, nurses have the opportunity to initiate change in each unit for a safer environment. Leaders demonstrate a willingness to learn and build internal structures and processes, such as a robust error reporting system. Hourly rounding helps generate reports for tracking of falls and skin breakdown not present on admission. Hourly rounding also helps identify near misses in the healthcare field. When nurse leaders advocate for hourly rounding, improvement in patient safety can be achieved. Hourly rounding is one of the many safety initiatives that can be implemented and proven to improve patient safety and decrease the risk for adverse events. As noted earlier, nurse leaders have been identified on each shift to help improve safety during that shift within the unit. These leaders continue to speak with each staff member about any safety issues that they feel need to be brought up. Then these nurse leaders speak with the management department within the unit to discuss safety issues that come up, especially on shifts that are off shifts, like night shift. Together, we can all work to achieve great safety goals within the healthcare system. Please note the references that were used to complete this Patient Safety Initiative presentation.